Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not-for-profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading physicians on important health topics. Today I'm joined by Dr. Skeet Jackson. She's a physician specialist at Bergen Newbridge Medical Center and Rutgers, New Jersey Medical School. As a non-invasive cardiologist, Doctor Skeet Jackson is board certified in adult echocardiography and board certified in nuclear cardiology. Her interests include preventive cardiology and medical education. Why go red? Women today are juggling more responsibilities than ever. They are stressed, navigating work, family, and simply trying to tread water in the sea of life. They wake up with an ever-growing mental to-do list, and their own health is really at the top. The pandemic has exacerbated this and significantly impacted their risk for heart disease and stroke. In fact, 1 in 5 people have reported lower physical wellness, and 1 in 3 have reported lower emotional wellness. Awareness is critical. Everyone needs to know the cardiovascular disease is the leading cause of death in women. This is something we should all be concerned about. Hi, Dr. C. Jackson. How are you today?
Hi, Rosemary. Thank you for having me. That was a very nice introduction, and everything you said is very important for us all to remember.
So, what is some of the symptoms of heart disease in women?
Well, women and men may have similar presentations for heart disease. The typical findings or symptoms that everyone sees on TV, usually during a movie or something, you're watching, you see someone starts to have chest pain, I can't breathe, I feel a heavy feeling on my chest. Those are the typical symptoms that we associate with a specific type of heart disease, namely a heart attack, right? Heart attacks come under a heading of disease called coronary artery disease, which is a disease of the arteries that supply the heart. So these symptoms typically are for obstruction or a blockage in one of the arteries that supplies the heart, and are typically uh, something like a heart attack or close enough to a heart attack. Women may have the same symptom, the chest pain, but what we need to realize as women is that we may present differently. We may just feel tired, this draining fatigue, for a few days. That could mean that you're having heart problems. You could have this feeling of indigestion, pain not up here, but under here, just always for a few days, feeling like your stomach's irritated. That could be a symptom of a significant heart disease or a heart attack. You could have the same chest pain on the left side, but you may also have pain on the right side of the chest. A woman may have pain in the upper back, in the arm, and the neck. All of these are symptoms of significant heart disease. And if you're feeling these things as a female, pain that's not in that typical area, very tired, having shortness of breath, then you do need to get checked out to see if there's a problem with your heart.
Got it. So, you talked about different symptoms just now, and they seem like everyday symptoms. Uh, you know, fatigue, pain, indigestion. Especially as we get older. What makes it an acute situation? I mean, would a woman go and go to the ED immediately if she's starting to present these symptoms, or is this something that she can take care of just going by her primary care physician?
Well, going to your primary care physician is always the right thing to do if you're not sure. The primary care physician will do what's needed to figure out if you need to go into the emergency room. But things that would indicate that you do need to go to the emergency room or call 911 are problems breathing. You're breathless, you're talking and you're noticing that you're not breathing well, you're having to catch your breath. Perhaps you have a flight of stairs in your home, and usually you're climbing up and down the stairs fine, but now you're finding you have to rest. And always, always pain in the chest, whether it's on the right side or the left side, that's a reason to go to the emergency room. These other vaguer symptoms like fatigue, Yes, I would say if you're more fatigued than usual, it's lasting a few days, go get seen by your primary doctor. And then if you need to go to the emergency room, you will be sent there appropriately. Generally, when you see your primary care physician or you go to the emergency room, an EKG is a simple test that's done to see if the problem does lie with the heart.
Makes sense. Makes sense. So, what are
Mhm.
the risk factors for heart disease in women?
Okay, the risk factors for heart disease for the general population are number one, being older. So if you're over 60 years old, uh, you're at higher risk of having a heart issue. Um, Other things that we do that we can modify ourselves that are increasing your risk for heart disease: smoking, increased alcohol intake, a diet that's high in fatty foods, fried foods. These are all risk factors for heart disease. Chronic diseases like high blood pressure, also known as hypertension, and diabetes. These, just being diagnosed with these diseases, puts you at higher risk of heart disease. Um, there are other things that are specific to women that we need to think about as increasing risk as well. So, if you ever had high blood pressure in pregnancy, this puts you at higher risk of heart disease. Um, so we call that gestational hypertension, right? If you ever delivered a baby preterm or premature, um, if you have autoimmune diseases, for example, lupus, arthritis, these increase your risk of heart disease. And if you've ever had breast cancer and been treated with radiation, in fact, any cancer in this area over the heart that has been treated with radiation increases your risk of heart disease. Also, certain chemotherapy regimens increase the risk of heart disease years down the line. That's not to say we should not be getting chemotherapy or radiation, but 10 years after, we do need to get our hearts checked out. And one thing I left out, sorry, being postmenopausal, that's very important as well. If you're a woman and you've gone through menopause, you're at higher risk of heart disease.
So, is hereditary have any factor to it? Like, for instance, my mom has heart disease, and
Yes,
it's significant. And all the factors that you just mentioned, being older and hypertension, they're there. But does that increase your risk for
it
heart disease?
it does. It does. If you have an immediate, what we call a first degree relative
Hmm.
that had a heart attack, that increases your risk. Or if you have a first degree relative, mother, father, brother, sister, with certain types of what we call heart failure, which is a weakness in the heart muscle, that also increases your risk of having it. It doesn't automatically translate that, yes, you will have it, but your risk is definitely elevated.
So how can I assess my risk? For myself, unfortunately, I'm a woman over 50. And again, some of the risk factors that you mentioned, I'm right in the middle of them. How can
Mhm.
I assess my own risk?
Well, take stock. Uh, Independent of symptoms, just think of your lifestyle. Did I ever smoke? Um, what's my diet like? Am I sedentary or do I exercise? What's my family history? Do I have diabetes? Do I have high blood pressure? If the answer is yes to any of these things, then you do have a higher risk of heart disease. But the main thing that we need to do is go get seen. Go get seen by our primary physician or primary provider. Get blood work done. Generally, we say at least once a year if you do not have any diagnosis. Get your cholesterol checked, get that blood test that we check for diabetes, get your blood pressure checked, because these are the things that we can do to assess our risk, um, that can make a change before anything gets more serious. So, on your annual visit, if your blood pressure is a little high, then you can make some lifestyle changes. You can decrease the salt in your diet, start exercising more, and then go back and get your blood pressure checked. If it's still high, then perhaps you do need medications for high blood pressure. And being on medications when you need it will decrease your risk of heart disease. Same thing for diabetes. If diabetes is untreated, your blood sugars are always high, then your risk for heart disease is very much more than if you are diagnosed with diabetes and on appropriate treatment, then the risk goes down. So take care of yourself. Think of yourself. We're always scheduling the visits for our spouses or children. Schedule a visit with your doctor and get checked out. When you're over 40, your assessment will also include an EKG. It's a simple test, it doesn't hurt. We put stickers on your chest and we do a tracing of your heart. And that will let us know if there's anything that needs to be further investigated as well. And this can be done by a primary doctor or by a cardiologist.
So is there a suggestion to, in addition to seeing your primary care physician, if you're over a certain age, to see a cardiologist?
Well, I would say that if you have a risk factor, any of the things we mentioned, it is wise to schedule a visit with a cardiologist. So if you smoke, if you have high blood pressure, if you have diabetes, if you have a strong family history of heart disease, if you had high blood pressure in pregnancy, um, if you have an autoimmune disease like lupus, it is wise to be seen by a cardiologist. If you do not have any risk factors, then I would say you can start with seeing your primary doctor and getting the blood panels done, getting the EKG done to see if you do need to be seen by a specialist after that.
Makes sense. So how can I reduce my risk?
Well, always we start with a difficult one, which is lifestyle changes. you know, medications are easy to prescribe and hard to take. Speaking as someone who finds it difficult to take a vitamin daily, I always forget. It's the lifestyle that's the main thing to reduce the risk. So 30 minutes of exercise a day. And this is exercise that gets your heart pumping and makes you sweat. So, it's cold outside. Perhaps you can't walk, but when it warms up, or if you can tolerate the cold, walk a few times around the block. If you can't do outside, if you can get an exercise, a stationary bike inside your home, do a little bit of that. Or, we all have, or most of us have access to the internet. YouTube has lots of videos, just put it in exercise videos and do your 30 minutes a day. That by itself reduces your risk significantly, no matter your age, no matter your weight, no matter your gender. Again, control the chronic diseases. Get seen for your chronic illnesses and make sure that your goals are where they should be. So if you have high blood pressure, the goal for your blood pressure should be the higher number at the top should be less than 130. The one at the bottom should be less than 80. Eat a low salt, low fat diet. Eat more vegetables. Eat more nuts. And I think I stop smoking. I think I said that already. And I'll limit alcohol intake. So these are the lifestyle modifications. And then, of course, the treatment of the diseases we defer to medically treat with prescription medications to our primary physicians and our cardiologists.
So in addition to, you mentioned lifestyle changes and treating your chronic illnesses, is there an opportunity to keep your, can your lifestyle changes be changed so much that you can not have to take medicine?
Oh, yes, most definitely. On diagnosis with any chronic disease, it definitely will depend on how bad it is. How high is your blood pressure? How bad is the diabetes? To say what will be the initial treatment. But some people need one medication, some people need 3 medications, some need diet changes. But always, the reason we follow with a physician is so that we can be reassessed. So you start a treatment, you go back, you check your blood pressure, you see how you're doing. And if you're doing well for a few months, then perhaps the medication can be decreased. So a lot of people try to avoid medication, but a lot of the time it is needed to get you where you need to be, to get you losing the weight, tightening up on your diet, so that you can get healthier, so that these blood pressure parameters and diabetes parameters improve, then the medication can be decreased.
Makes sense. So how is diagnosis of heart disease actually made?
Okay, so everything starts with the symptoms. So if you're feeling a symptom, or if you happen to be at the doctor and you report something or they find something, and further investigations may be ordered. So we start with the electrocardiogram, which is a longer name for the ECG or EKG. And then if further information is needed on the heart, we may move to an echocardiogram. An echocardiogram is an ultrasound of the heart, just as how we do ultrasounds for babies, where the gel is put on the belly and we look at a machine. We can do an ultrasound of the heart, and it's called an echocardiogram. And it looks at how the heart is pumping blood, and it looks at the valves and the other structures in the heart to see if these are all normal. Certain types of heart disease can be diagnosed this way. For example, diseases of the valves. Some people have valves that are leaking, some people have valves that are narrow, and these each have their own type of treatment. And these can also, valve problems can also cause symptoms like shortness of breath. So this is a test that we would do for certain symptoms. Other things that we can diagnose with an echocardiogram are a weakness of the heart muscle. The heart's not pumping well. We call that a cardiomyopathy. And if there are certain symptoms with that, we call it heart failure. So the echocardiogram is one of the very basic, simple, non-invasive tests that we do. Another test that we may do, especially if someone's having chest pain and we need to figure out, is it that there's a blocked artery in there? Maybe not a complete blockage that causes you to go to the emergency room because the pain is so serious, but just milder pain and a smaller blockage. So one of the tests that we can do is called a stress test. A stress test typically historically was done where you walk on a treadmill, and then we look at how your heart does with exercise. But nowadays we can do many variations. We can put you under a scanner. We can do an echocardiogram after you exercise or after you use a bicycle. But these are tests that we then use to decide if a more invasive test should be done after to check inside your heart. What's the more invasive test that we may do to diagnose an obstruction? It's called a catheterization of the heart. The body is entered through the wrist or the groin with needles. You're usually given a sedative, and a dye is used, the same dye that we use for CT scans, to take pictures of the vessels inside the heart and diagnose a blockage. So there's a variety of tests, but we start slow with the ones that don't hurt and that take the least amount of time and are non-invasive. And if needed, then we progress to more difficult tests that are more invasive.
So if I'm diagnosed with heart disease, what treatments are available?
Okay. So milder forms of heart disease, we will treat, as we were saying before, with lifestyle changes, treating the chronic diseases, and other medications for the heart. Other types of heart disease, more invasive methods need to be used. So one common type of heart disease, valvular disease. Sometimes surgery is needed to fix a valve that's very leaky or very narrow. Not very commonly, but sometimes. In terms of obstruction of the coronary arteries or the vessels that are inside the heart supplying blood, when the vessel is blocked, it causes a heart attack. And this procedure we just spoke about, called the catheterization of the heart, during that procedure, if a blockage is found, a stent is placed to open the blockage. So these are some of the procedures that are done. At the very far end of the spectrum, we have open heart surgery or bypass surgery for this same blockage in the heart. If medications are not enough, if a stent is not enough, then the chest has to be opened, and another blood vessel is used from a different part of the body and placed in the heart. And this, I'm saying it very simply, but these are operations that take 6-8 hours to bypass or go past the blockage to give you a new blood supply to your heart. So various things can be done, but it always starts with the lifestyle and the medication, and then reassessment.
It makes a lot of sense. I mean, it's a difficult thing to think about that there's so many risk factors, and women, just as myself, think it's something else. And that's a big piece.
Yes.
We didn't talk much about, and I mentioned it in the introduction, and I'd like to touch a little bit about it, but
Mhm.
is we talk about lifestyle and we talk about, numbers and keeping an eye on that and some of the risk factors. But is stress a portion of all of this that we need to keep in mind?
Yes, stress is a great portion of diseases of the cardiovascular system. Stress is a contributor to high blood pressures, and stress can even cause you to have pain in your chest um, through hormonal mechanisms and the flight mechanism. So, stress reduction is always a part of treatment of heart disease. Um, in fact, in women, uh, in a greater proportion than men. Sometimes, women come in with chest pain, typical heart symptoms, and when they do the procedure where we take a look into the heart, there's no blockage found. So women have the symptoms, this happens something, there's no blockage in the heart, and that's a specific type of coronary disease that, women are more predisposed to. And we do think that stress contributes to this. Um, so, again, exercise daily is thought to decrease stress, meditation, and, putting yourself first when it comes to your health to make sure that these things are found before they get to an advanced stage.
And this is great. And I really do appreciate you taking the time, doctor, and, explaining to us how important it is to be aware of your numbers and aware of your risk factors. And not only us as women, but also, other people that are watching this so that
Right.
they know and are aware of the risk factors of their women in their lives. So
Right.
thank you. You know, are there any additional ideas that you'd like to include that I haven't asked yet?
Oh, sure. Always. Um, I think that, as women, we need to advocate for ourselves and our health, especially when we seek medical care for specific symptoms and we do know that we're not feeling ourselves, no matter what the symptom may be. It may be abdominal pain, but in terms of the heart, perhaps the breathing's not the same. Perhaps you're having a pain in the epigastric area, right where the stomach is going around to the back. And maybe your symptoms are vague, but if they are persistent, advocate for yourself and get an investigation done, right? Because it is only after we do some kind of investigation that we can say for certain that there's nothing wrong. Unfortunately, statistically, women are more likely to present later with similar diseases than men. So we're more likely to present with heart problems at a more advanced stage than men do. And unfortunately, as well, especially in younger women, for the same diseases, um, that increases our mortality when compared to men. Women die in higher numbers than men, especially younger women who have heart disease. And I think this is because we tend to minimalize our symptoms and not think to ourselves that, this could be my heart. So, if the problem's here, if it happens when you're exercising or moving more, if there's any type of pain, get checked out. Make sure it's not your heart because heart disease is the number one killer of women in America and worldwide, even greater than cancer. And most people are scared of cancer, but we're not scared of heart disease. So it's
And
just
that's
a change in the mindset.
It's very true. It's very true. We do have one question. Doctor, does the cardiovascular disease have a relationship with low back pain or disorder, and what could that be responsible for?
Low back pain. I would not say low back pain, but I would say pain more in the upper or mid back can be an indicator for diseases of the heart. the cardiovascular system, especially diseases of the major vessel that exits the heart called the aorta. Um, the type of pain I'm speaking of, it's a very severe pain tearing through the chest into the upper back. Uh, it may be related to something called a dissection of the aorta or an aortic dissection, usually in people who have high blood pressure. Um, in terms of lower back pain, if you do have lower back pain, I would say yes, get it checked out. It may not be the heart, but it may be something else. Especially if the pain is severe, it's not going away, and it's not specifically with any type of posture, just always there. Especially if the pain is worse at night and associated with other things like weight loss. But there are heart diseases that come with pain, but not generally in the lower back, more in the upper or mid back.
Okay. Well, I want to again thank you so much for taking the time to talk about this important topic and to spread awareness about, cardiovascular disease in women. And thank you everyone for watching. And if you'd like to know more about Dr. Skeet Jackson or set an appointment up with her, please visit us at www.newbridgehealth.org or schedule an appointment directly on our access line, which is 201-225-7130. And again, thank you so much, Doctor, for taking the time to be with us today.
Okay, thank you so much for having me, Rosemary. I look forward to speaking with you again in any of these forums.
Thank you. Thank you. Take care.
Take care. Bye-bye.